We turn to Sierra Leone now, where health authorities are calling for extreme care among the population as an outbreak of Mpox intensifies. The West African country has reported more than 3,000 cases since the start of the year, along with 14 deaths linked to the disease. The WHO declared an outbreak of Mpox a public health emergency of international concern last August, and while this has largely worked to prevent a global spread, local outbreaks are still common in Africa. CGTN's Eric Kawa has more from Freetown.
This is just one of the over 1,600 Sierra Leoneans who have recovered from Mpox. For purposes of this report, we'll call him Alex. He got infected while on duty, but he sought treatment immediately. After 2 weeks under medical care, Alex is now fully recovered from the disease.
And
It wasn't easy. It wasn't easy because I have seen different videos of how Mpox attacks and targets people. So I was down mentally and physically too. I wasn't okay because I recalled that I have a wife at home, though she can abstain. But I also have a young child who is 10 months old.
But I get a young picking of the age of 10 months.
Mpox presents symptoms like fever, body aches and a rash. Alex is encouraging Sierra Leoneans to seek medical assistance as soon as they develop signs of infection.
Call on everybody for adhere to the precautionary measures.
I call on everyone to adhere to the precautionary measures the government has put in place because Mpox is real. Yes, for now, we notice that the death rates are low and people have the perception that Mpox doesn't kill, meaning it isn't bad. But after having gone through the virus, I know what I went through.
Health officials say the lessons learned from a serious Ebola outbreak in Sierra Leone and COVID-19 pandemic have helped them tackle the current Mpox outbreak more effectively and establish isolation centers in all districts across the country. The government is now focusing on vaccinating those facing a high risk of getting infected.
8.5 million people in this country, and we have 58,300 doses. So definitely, we have to prioritize. 1. Health workers who are in the front line, contacts of infected persons, because if somebody is infected now, all those around that person are high-risk contacts. So we encourage those to be vaccinated, and those that have other underlying ailments, like people that are immune to compromise. So these are actually the priority groups. So if we get more vaccines, we might even review those criteria.
People across Sierra Leone have been urged to avoid close contact with infected persons, practice good hygiene, and follow safety guidelines to prevent further spread of the disease. As Sierra Leone continues the battle in the Mpox virus in a series of public health challenges, communities, caregivers, and the government are racing to respond, drawing on lessons learned from the past and hope for the future. Eric Kawa, reporting for CGTN in Freetown, Sierra Leone.
While other countries across Africa also continue to report Mpox cases, Ethiopia recorded its first case this Sunday. A 21-day-old infant has tested positive in Moyale town near the Kenyan border. Subsequent testing confirmed the child's mother is also infected, and both of them have been placed in quarantine. The Democratic Republic of the Congo remains the epicenter of the outbreak, with both the clade 1A and 1B strains circulating in the country. Over 7,000 confirmed cases and 22 deaths have been recorded in the country since January. Uganda also continues to observe a large outbreak, reporting about 200 new confirmed cases per week. So far, over 4,000 cases and 28 deaths have been reported this year alone. Burundi, meanwhile, shows signs of declining cases. It is reporting less than 50 new confirmed cases per week. That's down from over 200 at the peak of the outbreak there. Now, while 5 African countries have reported cases so far this year, the outbreak, which began last year, has hit 25 countries on the continent. Well, we earlier spoke to Professor Yap Boum, an Africa CDC official, who said the latest outbreak is being driven by different variants of the Mpox disease.
Currently, we are dealing not with one Mpox outbreak, but we are dealing with more than that. In East and Central Africa, we are dealing with the Mpox outbreak due to the clade 1A and B, while in the West Africa, we are dealing with the one led by clade 2B. What does it mean? Up to now, we are around 60,000 cases since the beginning of the year, which is more than 73% of what we had last year in 2024. As we do speak right now, we have high concern around Sierra Leone, Democratic RDC, Congo, and also Uganda. Those are the top countries where we see an increased number of cases. Though in Uganda, we were seeing some few decrease over the last 3 weeks. This has not been confirmed, and rather we see the case increasing. So those 3 countries are really the high burden. But then we have some new countries that are coming on board, Togo, for example, Ghana, that has not reported for a while. So we are really having the challenge to deal with those 2 categories countries dealing with different Mpox outbreaks. So we have around 1,000 cases, that a new case every week, which is quite concerning. It's really exponential. And the challenge is that the case management, the bed capacity is really low. So we have like 60 bed capacity, while we have, as I mentioned now, more than 2,000 active cases. So that is one big challenge, the case management. Now, the spread itself, we see students, we see traders who are the most affected. The majority of them are men, around 60%. So it's really a challenge to really tackle the mode of transmission, the drivers of that outbreak. That's why the IMST, led by Africa CDC and WHO, we are sending experts on IPC, infection prevention and control, but also on surveillance, on vaccination, on laboratory, to ensure that we support effectively the country. So those colleagues will be there this week to ensure that we are all aligned and 1, reduce the spread of the disease, 2, improve the case management with the support of the World Food Program. We'll have most likely a hospital so that we can increase the capacity of taking care of the patient. We want also to support the country in taking care of the patient at home, the home-based care, but that is quite complex because you need the proper infrastructure. So we have a couple of milestones to achieve this week because we really want to bend the curve, and that's a big challenge. What can be done and what is being done is really the intensification of the response, of the surveillance. To date, we realize that almost 80% of the cases come to the hospital. While we are supposed to find them in the community, there were an action called Find Them All, where community healthcare workers were going in the field to find the patient, but because of the resources that are reducing, they were not able to continue. So that's the support that we are going to provide to them with the deployment of 200 community healthcare workers, with epidemiologists, so that they can go in the community, look for the patients, isolate them, take care of them adequately. That's 1. 2, increase the capacity for treatment. That is being done with different partners. So if we improve the surveillance, we improve the case management and the vaccination that will be targeted to those who are the most at risk. If we do that in a very timely fashion, we believe that we should be able to bend the curve.